You know that feeling? When your dog, your usually energetic pal, is just a bit off.
Mm-hmm.
Maybe they're suddenly guzzling water like never before, or you're doing way more potty trips
Yeah,
outside.
those little shifts.
And maybe they even look a little thinner, even though they seem ravenous.
Yeah.
It's easy to brush it off, right?
Yeah,
Just an off day. But sometimes those small things are pointing to something bigger.
they really can be. Our dogs tell us things in their own way, and changes in those basics, drinking, eating, energy, definitely warrant a closer look.
Absolutely. And today, we're going to tackle one of those bigger stories,
Yeah.
diabetes mellitus in dogs.
Eh,
We're digging into two really solid resources here.
okay.
First, there's a very compassionate guide for pet parents from the Pet Care Partner Hospitals group. Really helpful
Well,
stuff.
nice.
And second, we've got some key bits from differential diagnosis for diabetes mellitus, which sort of gives us the vet's perspective on figuring this out.
That's a good combination. And look, if you're listening because maybe your dog just got diagnosed or you're seeing some signs and you're, worried,
Yeah.
just know you're definitely not alone in this. Canine diabetes, it's more common than many people realize. And importantly, with the right approach and support, managing it is very achievable.
Totally. So our mission today is to use these sources to bring some clarity for you. We want to unpack what it is, why it's serious, the signs to watch for.
How it's diagnosed.
Exactly. The diagnosis, the treatment options, and really how to give your dog the best possible care. So let's start at the beginning. What exactly is diabetes mellitus when we're talking about dogs?
Okay, so in simple terms, canine diabetes mellitus is a chronic hormonal thing. It affects how the dog's body handles blood sugar or glucose.
Right.
And the main hormone involved is insulin, which comes from the pancreas. Now, in a diabetic dog, one of two things is usually happening. Either the pancreas isn't making enough insulin, or the body's cells just aren't responding to the insulin that is there like they should. Insulin resistance, basically.
Got it. Insulin is like the key, isn't it?
Yeah.
Letting the sugar, the glucose from food into the cells for energy. So if the key is missing or the lock's jammed.
That's a perfect way to put it. If there's not enough insulin or the cells ignore it, glucose can't get inside, so it just builds up in the blood. That's hyperglycemia, high blood sugar.
Ah,
But the ironic thing is, even with all that sugar floating around in the blood, the cells themselves are starving because they aren't getting the fuel they need.
wow. Okay. That definitely sounds like a problem. So it's not just about having high blood sugar numbers then. Why is uncontrolled diabetes considered so serious?
Well, yeah, if that high blood sugar isn't managed, it can lead to some really severe, even life-threatening problems down the line.
Like what?
One of the big immediate worries is something called diabetic ketoacidosis, or DKA.
DKA. Okay.
This happens when the body gets desperate for energy and starts breaking down fat instead. But this process creates byproducts called ketones.
Right. And if ketones build up too much, they become toxic, making the situation with the high blood sugar even worse. It's a real metabolic crisis.
That sounds incredibly dangerous.
Of course.
So yeah, it's definitely more than just feeling a bit sluggish. What other long-term risks are there if it's not managed well?
Over time, that constant high blood sugar can really damage tiny blood vessels and nerves all over the body. This can lead to organ damage.
Wow.
And a really, really common complication we see in diabetic dogs is cataracts. Their eyes get cloudy, and it often leads to blindness, sometimes quite quickly.
Blindness, okay.
They also become much more prone to infections. Urinary tract infections, or UTIs, are especially common in diabetic dogs.
That's a lot to think about. But you mentioned the Pet Care Partner Guide had a more positive note.
It did, absolutely.
Yeah.
It really stressed that with early diagnosis and, crucially, consistent care, the outcome can be very different.
That's good to hear. Yeah, while diabetes isn't curable, it is manageable. With a good plan and dedication, many diabetic dogs live happy, full lives for years. It's about learning a new normal, a new routine for them.
That is definitely encouraging. So let's talk causes. What actually makes a dog develop diabetes? Is it just one thing, or is it usually more complicated?
It's almost always more complicated. Several factors can be involved. One major cause is when the dog's own immune system messes up and attacks the insulin-producing cells in the pancreas.
Autoimmune, like type 1 in people.
Exactly. Very similar mechanism. Another really significant factor is obesity.
Okay.
Being overweight can make the body's cells less sensitive to insulin. That's the insulin resistance we talked about. Think of it like too much static interfering with the insulin signal getting through to the cells.
That's a helpful way to picture it. So keeping dogs lean is important for preventing this too, it sounds like. What else?
Well, chronic inflammation of the pancreas, that's pancreatitis, if it goes on for a long time, it can damage those crucial cells.
Makes sense.
Certain medications can also increase risk, especially using corticosteroids like prednisone long term.
Steroids.
Yeah. And then there are other hormonal imbalances. Cushing's disease is one that can predispose dogs to diabetes. And there's a specific condition in unspayed female dogs related to their heat cycles, distress-induced growth hormone excess that can trigger it too.
So a real mix of things that immune system, weight, other diseases, meds, hormones. What about just getting older or certain breeds?
Yes, absolutely. Age is definitely a factor. It's more common in middle-aged to older dogs.
Okay.
And there are absolutely predispositions. The pet care guide lists breeds like Samoyeds, miniature schnauzers, poodles, dachshunds, beagles, and Keeshonds as being more at risk.
Interesting list.
Yeah, and while we don't know all the exact genetic reasons yet, it's clear genetics play some role. Research is ongoing there, trying to pinpoint those specific genetic markers.
Fascinating stuff. So, okay, if someone's listening and maybe their dog fits one of those risk categories or they're just noticing some changes, what are the absolute key signs they should look out for?
The classic signs, the ones vets often call the 3 Ps, are usually the first things owners notice.
The 3 Ps.
Yeah. Polydipsia that's drinking a lot more water than usual. Polyuria that's peeing more often or larger amounts. You might find yourself filling the water bowl constantly or having accidents in the house.
Okay, drinking more, peeing more was the 3rd P.
Polyphagia, that means increased hunger. Your dog might seem starving all the time.
But wait, didn't you say they often lose weight? How can they be eating more but losing weight?
Exactly. That's the paradox and a huge red flag. They're eating more, but because their body can't use the glucose from that food properly for energy, they actually lose weight. The fuel isn't getting to the cells.
Wow. Okay, so increased thirst, increased urination, increased hunger, and weight loss. That combination really stands out. Are there other signs?
Yes. You might notice your dog just seems tired, lethargic, less playful than usual.
Lower energy.
Definitely. Another big one is changes in their eyes. They might look cloudy. That can be the start of cataracts, which, as we said, are really common. Sometimes vision loss can seem quite sudden.
Cloudy eyes, okay.
And keep an eye out for recurring infections, especially those UTIs we mentioned. If your dog keeps getting them, diabetes could be an underlying factor.
Right.
And then in more serious situations, especially if that DKA is starting to develop, you might see vomiting.
Okay, vomiting too. These are all really crucial signs, and the guide was pretty clear. Don't wait and see with these symptoms.
Absolutely not. Prompt veterinary evaluation is critical. Getting a diagnosis and starting treatment early can prevent those really serious complications like DKA.
Right. So say an owner brings their dog in with these kinds of concerns. What's the diagnostic process usually look like at the vet's office?
Well, it starts with a thorough physical exam. The vet will check their weight, overall condition, hydration, listen to their heart and lungs, all the usual stuff. Okay.
Then blood work is absolutely essential. They'll measure the blood glucose level.
The sugar level.
Exactly. Now, a single high reading might happen just due to stress from the vet visit.
Oh, yeah.
So what the vet is looking for is persistently high blood glucose. The differential diagnosis source mentions general thresholds, but it's really about confirming it's consistently high, not just a one-off spike.
That makes sense. So more than one test usually.
Often, yes, or they'll use other tests to confirm. A urinalysis is another key piece of the puzzle.
What are they looking for in the urine?
2 main things, glucose and ketones. Normally, there shouldn't be any glucose in the urine. If there is, it's called glucosuria. It strongly suggests diabetes.
Okay.
And finding ketones in the urine is a warning sign for that DKA we talked about. It means the body is breaking down fat for energy inappropriately.
Right, the emergency state.
Exactly. There's also a blood test called a fructosamine test. This one is really useful.
Yeah. Instead of just showing the blood sugar at that exact moment, it reflects the average blood glucose level over the previous 2 to 3 weeks.
Oh, like an A1C test in humans.
Very similar concept, yes. It gives a much better picture of the overall trend and helps confirm the diagnosis, and it's great for monitoring treatment later on, too.
That sounds really helpful. So blood glucose, urine tests, fructosamine, anything else?
Well, it's also really important for the vet to check for other potential health problems that could be causing similar signs or that might complicate diabetes management.
Like those other conditions you mentioned.
Precisely. They'll often run tests to screen for things like pancreatitis or Cushing's disease and check again for urinary tract infections.
Makes sense to get the full picture.
The differential diagnosis source also notes that sometimes measuring insulin levels in the blood can help figure out if it's mostly a lack of insulin or that resistance issue. But, like the pet care guide stresses, for dogs, the treatment almost always involves giving insulin anyway.
Right. So, okay, the diagnosis is confirmed. It's diabetes. What happens next? What are the main treatment approaches?
The pet care guide really focuses on three core pillars for management: insulin therapy, diet, and exercise.
Okay, let's break those down. Insulin first sounds like that's usually non-negotiable for dogs.
Pretty much, yes. Because the core problem is that lack of effective insulin. Lifelong insulin injections are generally essential for diabetic dogs.
Lifelong. Okay.
There are a few different types vets use, like Vetsolin NPH, which is sometimes called Humulin N, and occasionally one called Detamir or Levemir, maybe for specific cases.
Different types.
Yeah.
And they work differently.
Yeah, they have different speeds and durations of action. Some work faster, some last longer. The vet chooses the best type and dose based on the individual dog's needs and how their blood sugar responds throughout the day.
And how often are the shots usually given?
Most dogs need injections twice a day, typically about 12 hours apart. And crucially, these need to be timed carefully with their meals.
Ah, okay, that leads right into the diet part. Consistency sounds key there.
Absolutely critical. Consistent, timed meals are vital. You want to feed them the same amount at the same times each day, coordinated with those insulin injections. This helps keep the blood sugar levels as stable as possible.
And what kind of food? Just any dog food?
No, definitely not. Vets usually recommend specific prescription diabetic diets. These are typically formulated to be higher in fiber,
Okay.
lower in fat, and use complex carbohydrates. The fiber and complex carbs help slow down how quickly glucose gets absorbed after eating, preventing big sugar spikes.
High fiber, low fat, complex carbs. Got it.
And managing weight is huge here, too. If the dog is overweight, getting them to a healthy weight is incredibly important because obesity really worsens that insulin resistance we talked about.
Right, it makes it harder to control.
Exactly. And the differential diagnosis source also mentions that high levels of fats in the blood, hyperlipidemia, which often goes along with obesity, can also mess with glucose metabolism and insulin effectiveness.
So diet is really specific and tied to weight management. What about the third pillar, exercise? How does that fit in?
Regular, moderate exercise is definitely beneficial. It can help the body use glucose more effectively.
Good. So more walks.
Yes, but again, consistency is the name of the game. You want a predictable exercise routine, not like couch potato all week and then a 5-mile hike on Saturday.
Okay, why not?
Because those sudden bursts of intense activity can cause unpredictable drops in blood sugar, which can be dangerous, especially with insulin on board. So, steady, moderate activity, same time, same intensity each day if possible, is the ideal.
Consistency, consistency, consistency. It
Yeah.
sounds like the mantra for managing diabetes.
It really is. For insulin, for food, for exercise.
So once you've got the diagnosis and the initial plan with insulin, diet, and exercise, it's not just set it and forget it, right? Monitoring must be ongoing.
Oh, absolutely essential. Diabetes management requires continuous monitoring and adjustments.
What does that involve typically?
It often involves doing blood glucose curves. This
Wow.
means checking the dog's blood sugar levels every couple of hours over a 12 or 24-hour period.
At home or at the vet?
It can be done either place. It shows how the insulin is working throughout the day, how low the sugar goes, how high it gets before the next dose, how long the insulin lasts.
Okay, the curves. What else?
Regularly checking those fructosamine levels we mentioned gives that longer-term picture of control, complementing the daily curves.
Right, the average sugar level.
Yep. And regular urine checks are important too, looking for glucose spillover or signs of those pesky UTIs.
And you mentioned eyes earlier.
Yes, regular eye exams are crucial for catching cataracts early. Sometimes treatment can help preserve vision if caught soon enough, or at least prepare the owner.
Gotcha.
And of course, regular checkups with the vet are non-negotiable. They'll assess how things are going, review the monitoring results, and make any needed tweaks to the insulin dose, the diet, or the exercise plan. It's a dynamic process.
It definitely sounds like a team effort and requires real diligence. But hopefully, all that monitoring helps prevent major problems. Speaking of which, what are the really critical situations, the emergencies, that owners absolutely need to be able to spot?
There are two big ones you need to have on your radar: DKA, diabetic ketoacidosis, and hypoglycemia, which is dangerously low blood sugar.
Okay, DKA first. What are the warning signs?
For DKA, watch for things like persistent vomiting, seeming extremely tired or weak, maybe even collapsing, Labored breathing is another sign. And sometimes owners notice a weird, sweet, almost nail polish remover smell on their breath.
Sweet breath. Okay, that's a key one.
Yeah.
And hypoglycemia, low sugar.
Hypoglycemia can happen if maybe they get too much insulin or miss a meal after getting insulin or exercise too hard unexpectedly. Signs include sudden weakness, trembling or shaking, seeming disoriented or confused.
Okay.
In severe cases, seizures or collapse.
Wow, both sound incredibly serious.
They are. Both DKA and severe hypoglycemia are life-threatening emergencies. If you see any of those signs, you need to contact your vet or an emergency clinic immediately. Knowing what to look for and acting fast is vital.
Absolutely crucial information. So those are the big emergencies. Are there other, maybe less dramatic complications that can still pop up even with decent management?
Yes. Even with good effort, sometimes control isn't perfect. So you might still see some level of increased drinking and peeing, polyuria polydipsia, or struggle with weight maintenance if things aren't quite dialed in.
Right.
Cataracts, as we've said, are very common in dogs, unfortunately, even with good control sometimes. That increased risk of infections, especially UTIs, remains a concern.
Okay.
Things that are less common in dogs but possible include peripheral neuropathy, nerve damage causing weakness, usually in the back legs, or very rarely skin problems called diabetic dermatopathy. But those are less frequent than in, say, diabetic cats.
It really highlights how important that consistent management and vet partnership is, doesn't it? To try and minimize these risks.
It really does, and it's good to remember that support is there. The Pet Care Partner Guide really emphasized that team approach.
Yeah, they did.
Your veterinary team, the vets, the techs, they're there to give you the right diagnosis, create that tailored plan, provide ongoing education, help you learn how to give injections, adjust the diet.
And handle emergencies.
Exactly. Knowing you have access to 24/7 emergency care if needed brings a lot of peace of mind. It's all about that regular monitoring and compassionate support for both you and your dog.
And the big takeaway, the hopeful message through all this seems to be that, yes, it's a serious diagnosis. It's a lifelong commitment. But canine diabetes is manageable. With that dedication and the right care team, many, many dogs go on to live really good, active, happy lives for years after they're diagnosed.
That's absolutely the key message. It takes work, definitely requires that commitment from the owner and a strong partnership with the vet team. But the outlook for a well-managed diabetic dog today is generally very positive.
So wrapping up our deep dive today, it really boils down to that partnership, doesn't it? Between you, the owner who knows your dog best, and your veterinary team.
Exactly.
Being proactive, watching for those subtle changes, sticking with the plan, the insulin, the food, the exercise, the checkups. It's all vital for their long-term health and just their day-to-day quality of life.
It really underscores how much consistent care matters for any chronic condition in our pets. Early detection, steady management, it makes all the difference.
It truly does.
Yeah.
So if anything we've discussed today resonates, if you have concerns about your dog's health, whether it's a potential diabetes sign or you're already managing a diagnosis, please reach out to your vet. That conversation is always the most important first step.